Hello, my name is Peter, and I am wondering who is familiar with the drug ketamine. Does anybody you know, or you personally going through problems dealing with depression, PTSD, or alcoholism? While traditional treatments for depression, PTSD, and alcoholism have often proved inadequate and ineffective, ketamine represents a novel and new approach to revolutionize how we treat these conditions. After concluding my research over several sites, documents, and articles, I am eligible to present this knowledge in hopes that it will come with benefits for those who need it or if you're personally going through it. So, what is alcoholism, and how could ketamine help those suffering from an alcoholic addiction? Alcoholism is pretty self-explanatory. It is someone that is addicted to alcohol. Believe it or not, ketamine is an effective treatment for alcoholics. Why? Ketamine completely reduces cravings and prevents relapses at almost double the rate, a much higher rate. According to researcher Glazuko, alcoholism is prevalent in 1 to 12 males in the U.S., 1 in 25 women in the U.S., and an additional 623,000 people, in the ages of 12 and 17 that have already been diagnosed with alcohol problems. This is huge. This is a huge issue for not only our country, but for our lifestyle. Alcoholism is completely dangerous, though don't be scared. Medication and ketamine can help. Though ketamine does have its downsides of side effects, including heart rate, changes in respiratory function, and changes in blood pressure. It should be monitored closely by a doctor and should be recommended by a doctor. A side effect of alcoholism is depression and can completely take over someone's mental health. Depression has feelings of sadness, guilt, or unmotivation. And I was wondering, could ketamine help? Interestingly, the use of ketamine for treating alcoholism has led to its exploration for potential treatments such as depression and PTSD. Ketamine is a powerful anesthetic that is used in alleviating patients' long-term depression, and I was wondering, how does ketamine help alleviate people's long-term depression when there have been traditional treatments for long-term depression that have not been successful? Well, any traditional treatments include therapy, talking, and as we know, with postpartum depression and long-term depression, this is really hard to alleviate. It made me even wonder, is there a better treatment for long-term depression than ketamine? And if so, is there a fix for long-term PTSD or very violent PTSD? Well, researcher Glazuko also found that PTSD has a prevalence of 8.7% in the US, with a prevalence of 3.5% in any given 12-month period. This is out of all citizens of the US and is very scary, especially being that many people go through many of these changes. Though, despite being such a alarming number, the amount of people drinking alcohol, the amount of depression cases we see in the U.S., and now that we see the prevalence of PTSD, it could be really scary. Though PTSD and depression have long-term effects, despite the negative effects of ketamine, it has shown a great promise for treatment of a variety of medical conditions, even outside of depression, PTSD, and alcoholism. Post-traumatic stress disorder and chronic pain, anywhere from completely death-defying anxiety to mental health disorders, ketamine has been called a game changer in the treatments of depression, PTSD, alcoholism, and many other cases. And this has been shown because it is a rapid and significant antidepressant and is very helpful in many cases. It's an anesthetic, and that means that this medication is very alleviating, especially for patients with long-term depression or PTSD. Ketamine could be very helpful for patients with alcoholism due to its game-changing ideas on how it stops, how it very much reduces how much somebody is craving alcohol, and it also reduces significantly the fact that they will go back to the drug or go back to alcohol. So ketamine actually works on your glands in your brain, though it's not understood fully how it works. It is a very reliable and quick treatment to those who really need it. So as we see in the U.S., treatment isn't cheap. It's very expensive. Well, ketamine, you're gonna have to have a little background on it, because it comes with its share of side effects, cost for treatment, and if the treatment's really right for you. In most cases, it's for severe treatment, or for traditional treatments that have not worked. Understanding the effects of ketamine is crucial to know. It's very, very important for us to understand the medical effects of ketamine, because it's such a big game changer for our daily medicine, our modern medicine. As an alternative treatment option, ketamine may offer a new approach to these conditions that has potential to provide rapid and significant relief to those who have not responded to traditional treatments.